Gentlemen, let me ask you something that many men think about, but very few ever speak out loud. If you're over the age of 50, 60, or even 70, and you still masturbate, have you ever quietly wondered whether it's truly good for your health? Have you questioned whether it could be affecting your testosterone, putting stress on your prostate, or somehow taking away your strength as a man? If those thoughts have ever crossed your mind, I want you to know that you are far from the only one. In fact, this is one of the most common questions men ask me during private appointments, often in a very low voice, because they feel embarrassed to even bring it up. The reality is that too many men spend years surrounded by myths, old beliefs, confusing advice, and information that simply isn't supported by science. Today, we're going to clear away that confusion. Once we remove the shame and focus on what medical research actually tells us, the picture becomes much more encouraging than most people expect. Before we continue, I'd love to know where you're watching from today. Leave your country or city in the comments because it's always inspiring to see how many men from around the world are joining these honest conversations about health. And while you're here, please take a moment to like this video and subscribe to the channel. That simple support allows us to continue creating straightforward, judgment-free information that helps men make better decisions about their health. Now, let's begin by addressing one of the biggest myths out there. Many people still believe that masturbation becomes unhealthy once a man reaches a certain age. They say it weakens the body, drains your energy, lowers your hormones, or somehow makes you less masculine. Maybe you've heard these ideas growing up, listened to them from friends, read them online, or learned them through cultural traditions that were never supported by medical evidence. But modern science tells us a very different story. Self-stimulation is not something that only belongs to younger men. When practiced responsibly and in moderation, it can actually become a healthy part of aging. It may even provide physical and emotional benefits that many men never realize. Of course, just like every healthy habit, balance is essential. When it's done with awareness and good judgment, it can support your overall well-being. When it's done carelessly or excessively, it can also create problems that every man should understand. That's exactly what we're going to cover today. I'll explain 10 science-backed benefits that many men have never heard about, followed by 10 important risks you should recognize so you can keep this habit healthy and safe. By the end of this discussion, you'll have a much clearer understanding of how to protect your prostate, preserve your sexual health, and maintain confidence as you grow older. For those of you who are joining us for the first time, let me introduce myself. My name is Dr. Nora Hayes. I'm a board-certified urologist and sexologist, and for the past 7 years, I've dedicated my practice to helping men over the age of 50 improve their prostate health, strengthen intimacy, overcome sexual concerns, and regain confidence in their bodies. Throughout my career, I've met countless men who sit down in my office, hesitate for a moment, lower their voice, and finally ask, "Doctor, can I be honest? At my age, is it still okay if I masturbate?" Every single time I hear that question, my answer begins the same way. You deserve honest medical guidance based on evidence, not fear, shame, outdated opinions, or half-truths that leave you feeling confused. That's why today we're going to look at the facts together. Let's begin with the benefits that often surprise people the most. And I encourage you to stay with me until the end, because the final benefit is something that receives very little attention, yet it may play an important role in maintaining both your sexual health and your overall well-being as you age. The first benefit is maintaining the health of your penis. Think about masturbation as gentle physical exercise for this part of your body. Every healthy erection sends oxygen-rich blood into the spongy erectile tissue known as the corpora cavernosa. That circulation helps keep the tissue flexible, healthy, and less likely to develop scarring or fibrosis over time. From a biological standpoint, regular blood flow supports normal erectile function. Emotionally, it also helps preserve confidence, because one of the greatest worries many older men experience is the fear that their body may not respond when intimacy becomes important. From a practical point of view, regularly keeping this natural system active helps it remain more dependable over the years. The second benefit involves prostate health, and this is one of the most researched areas in men's medicine. A well-known study conducted by researchers at Harvard found that men who ejaculated at least 21 times each month had approximately a 33% lower risk of developing prostate cancer compared with men who ejaculated less frequently. Why might this happen? One possible explanation is that ejaculation helps clear older prostate fluid along with inflammatory substances and waste products from the prostate ducts, supporting healthier prostate function over time. Instead of creating fear, this information gives many men a sense of reassurance. You're not automatically harming your prostate through ejaculation. In many cases, you may actually be helping maintain its long-term health when this habit is practiced in a balanced and healthy way. Now let's continue with the third benefit, because this is another area that many men rarely think about. Every time you reach orgasm, the muscles in your pelvic floor naturally contract and relax. Those repeated contractions work the pubococcygeus muscle along with the surrounding pelvic muscles, almost like a gentle internal workout. Biologically, stronger pelvic floor muscles can contribute to firmer erections, better control during ejaculation, and a lower risk of urinary leakage as you get older. Many men spend money on special exercises or expensive treatments to strengthen this part of the body, without realizing that regular, moderate sexual activity can also help keep these muscles active. From a practical perspective, it's a simple and completely natural way to support an important part of your health. The fourth benefit is something many people notice almost immediately after orgasm, and that's a reduction in stress. During climax, your body lowers levels of cortisol, which is the primary stress hormone. When cortisol drops, several positive things can happen. Blood pressure may decrease, your cardiovascular system experiences less strain, and feelings of anxiety often begin to fade. Many older men tell me that after a stressful day filled with responsibilities or worry, they finally feel calm enough to relax. Emotionally, this can mean the difference between spending hours lying awake with racing thoughts or drifting into a restful night's sleep. Your body is designed to release tension in healthy ways, and this is one of those natural mechanisms when practiced responsibly. The fifth benefit involves your brain. During orgasm, your nervous system releases chemicals such as dopamine and oxytocin. Dopamine is strongly connected with motivation, pleasure, and reward, while oxytocin is often called the bonding hormone because it promotes feelings of comfort, relaxation, and emotional well-being. Together, these natural chemicals can improve your mood and may even help reduce symptoms associated with stress or mild depression. Practically speaking, many men notice that they become more patient, more positive, and emotionally balanced after these healthy chemical changes occur. Those benefits don't just affect you personally. They also influence the way you interact with your spouse, your family, your friends, and the people around you. A healthier emotional state often creates healthier relationships. The sixth benefit is something that can literally help save lives, and that's improved body awareness. When you regularly examine and touch your own body, you become familiar with what is normal for you. That makes it much easier to recognize unusual changes if they ever appear. You may notice a lump that wasn't there before, a new curve in the penis, unusual swelling, discomfort, or pain that deserves medical attention. Early detection is one of the most powerful tools we have in medicine. I've personally treated men who discovered testicular cancer at an early stage simply because they were familiar with their own anatomy. Others recognized the early signs of Peyronie's disease before the condition became severe. Those early discoveries gave them more treatment options and much better outcomes. Knowing your body isn't something to feel embarrassed about. It's part of taking responsibility for your health. The seventh benefit is better sleep quality. As we grow older, many men struggle with insomnia or restless nights. After orgasm, the body experiences another series of healthy hormonal changes. Oxytocin levels rise, prolactin increases, and cortisol continues to fall. Together, these create an environment that encourages deeper, more restorative sleep. Rather than relying immediately on sleeping pills or other medications, some older men find that this natural biological response helps them relax enough to fall asleep more easily. While it isn't a cure for chronic insomnia, it can certainly become one healthy piece of an overall sleep routine. The eighth benefit is improved circulation throughout the pelvic region. Most people associate erections only with the penis, but healthy blood flow extends far beyond that. Increased circulation supports the prostate, the bladder, nearby muscles, nerves, and surrounding tissues. Better blood flow delivers oxygen and nutrients while helping remove waste products from the area. Over time, maintaining healthy circulation may contribute to stronger bladder control, healthier prostate tissue, and a reduced likelihood of problems linked to poor pelvic blood flow. Once again, moderation is important, but healthy circulation remains one of the body's greatest defenses against age-related decline. The ninth benefit focuses on improving ejaculatory control. Many men worry that they finish sooner than they'd like during intimacy with a partner. Masturbation can provide a safe and private opportunity to practice techniques that improve control, including the well-known stop-start method or the squeeze technique. These methods help you become more aware of your level of arousal and teach you to recognize the point just before ejaculation occurs. With regular practice, many men develop greater confidence and better control during partnered intimacy as well. The goal isn't simply lasting longer, it's understanding your body's responses and learning how to manage them naturally. That confidence often reduces anxiety, which itself can improve sexual performance. Finally, we come to the 10th benefit, and this is one that surprisingly few people discuss. It helps keep sexual desire alive as you age. Many people think of the penis as the primary sexual organ, but in reality, the brain plays the leading role. Sexual thoughts, attraction, desire, and arousal all begin inside the brain. Regular self-stimulation helps keep those neural pathways active, preventing them from becoming less responsive over time. Emotionally, this can protect an important part of your identity and confidence as a man. Even if you don't currently have a partner, maintaining healthy sexual function means you're more prepared if intimacy becomes part of your life again in the future. Remaining sexually healthy doesn't mean chasing youth. It means preserving a normal, healthy part of yourself for the years ahead. Looking at these 10 benefits together, it's easy to understand why modern research paints a much more positive picture than many outdated beliefs. But medicine is always about balance. Every healthy habit has limits, and masturbation is no exception. While it can provide genuine health benefits, there are also important risks that every man should recognize. Understanding both sides allows you to make informed choices instead of relying on myths or fear. So now, let's turn our attention to the other side of the conversation and discuss the 10 risks you should know, along with the practical steps that can help you avoid them. Let's begin with the first risk, and it's one that has very little to do with your body and everything to do with your overall quality of life. That risk is social isolation. Masturbation itself is not the problem. The concern begins when it slowly replaces genuine emotional and physical connection with other people. Human beings are naturally social, and meaningful relationships play an important role in both mental and physical health. If self-pleasure becomes your only source of comfort or satisfaction, you may gradually withdraw from opportunities to build real intimacy with a partner, family, or close friends. Over time, that isolation can affect your emotional well-being far more than you realize. The healthy approach is to see masturbation as one part of a balanced life, not as a substitute for human connection. It should support your well-being, not replace the relationships that give life meaning. The second risk involves the health of your skin. Repeated friction without proper lubrication can create tiny tears in the delicate skin of the penis. These small injuries may seem insignificant at first, but they can lead to irritation, inflammation, discomfort, and in some situations, increase the risk of infection. Fortunately, this problem is easy to prevent. Using a high-quality water-based lubricant helps reduce unnecessary friction and protects the skin from repeated stress. Think of it as taking proper care of any other part of your body. Gentle treatment today can help prevent avoidable problems tomorrow. The third risk is reduced sensitivity through repetition. The human brain is incredibly adaptable. If you stimulate yourself in exactly the same way every single time, using the same pressure, speed, position, and technique, your nervous system gradually becomes accustomed to that specific pattern. As a result, it may become more difficult to respond to different types of stimulation, particularly during intimacy with a partner. Some men begin to notice that they can only reach orgasm under one very specific set of conditions. The good news is that this isn't permanent for most people. The solution is simply to avoid training your brain into one routine. Vary your technique, adjust the rhythm, switch positions occasionally, or even use your opposite hand from time to time. Small changes help keep your nervous system flexible and responsive. The fourth risk is one that deserves serious attention because it can sometimes point to an underlying medical condition. If you consistently find that you can achieve and maintain an erection during masturbation, but struggle to do so with a partner, don't assume it's just part of getting older. In some cases, this difference may signal erectile dysfunction linked to diabetes, cardiovascular disease, circulation problems, hormone imbalances, or low testosterone. Emotional factors such as anxiety or relationship stress can also contribute. Rather than ignoring these warning signs, speak with your doctor. Early evaluation often leads to earlier treatment, and in many cases, addressing the underlying cause improves both your sexual health and your overall health. The fifth risk involves posture, something very few men ever consider. Many people masturbate while sitting in awkward positions, leaning forward for long periods, or placing pressure on the pelvic area by sitting on a hard chair or edge of the bed. Over time, these habits may place unnecessary pressure on the pudendal nerve, which plays an important role in sensation throughout the pelvic region. Repeated compression can contribute to numbness, tingling, discomfort, or even chronic pelvic pain in some individuals. Fortunately, preventing this problem is usually simple. Choose a comfortable position that allows your body to remain relaxed and well supported. Lying down or sitting with proper back support reduces unnecessary strain on the nerves and muscles. The sixth risk is emotional escapism. Every person experiences stress, loneliness, disappointment, or anxiety at different stages of life. Masturbation can certainly provide temporary relaxation, but if it becomes your only method of coping with difficult emotions, it may gradually develop into an unhealthy dependency. Instead of solving the source of stress, it simply delays dealing with it. A healthier approach is to build a variety of coping strategies into your life. Regular physical activity, meaningful conversations with people you trust, hobbies, meditation, prayer, or spending time outdoors can all support emotional resilience. When masturbation remains just one healthy part of a broader lifestyle instead of your only emotional escape, it is much less likely to become a problem. The seventh risk is guilt and shame.